Hello, and welcome to 6-Minute Health Bites, where we crunch complex health concepts into easy-to-digest bites. Today's topic is ready to boost your wellness wisdom, so buckle up and let's start the timer. Today, we'll be discussing the recommended adult health screening schedule in the United States. Taking care of your health is a crucial aspect of leading a fulfilling and vibrant life. Regular health screenings play a vital role in identifying potential health concerns at an early stage when they can be managed effectively. By undergoing recommended screenings, you are taking proactive steps toward maintaining optimal health and preventing the development of serious conditions. You may be wondering, what exactly are health screenings? Health screenings are medical tests or examinations that are performed to detect potential health issues before any symptoms manifest. These screenings can vary depending on factors such as age, gender, and individual risk factors. By detecting conditions early, screenings can often lead to more effective treatments and better health outcomes. The recommended adult health screening schedule in the U.S. is based on the guidance of the American Medical Association. The recommendations are based on the latest scientific evidence and take into account the individual's age, sex, and risk factors. The following are the AMA's recommendations for adult health screenings. Blood pressure. Adults should have their blood pressure checked at least once every 2 years. High blood pressure, or hypertension, is often referred to as the silent killer because it typically has no symptoms but can lead to serious health issues. Regular blood pressure screenings help identify hypertension early, allowing for timely intervention and management. Cholesterol. Adults should have their cholesterol checked at least once every 5 years. Cholesterol screenings involve measuring the levels of different types of cholesterol in your blood. High levels of low-density lipoprotein cholesterol, often termed bad cholesterol, can increase the risk of heart disease. The purpose of cholesterol testing is to assess your lipid profile and identify any imbalances that require attention. Diabetes. Adults should be screened for diabetes if they are overweight or obese, have a family history of diabetes, or have other risk factors. Diabetes screening aims to detect elevated blood sugar levels, either to diagnose diabetes or identify individuals at risk of developing the condition. Diabetes can lead to serious complications, including cardiovascular disease, kidney damage, and nerve damage. Screening for diabetes helps initiate early management strategies to control blood sugar levels and reduce the risk of complications. Colorectal cancer. Screenings for colorectal cancer are crucial as early detection significantly improves treatment outcomes. Commonly recommended screenings include colonoscopy, sigmoidoscopy, and fecal occult blood testing. These screenings aim to detect abnormalities such as polyps or cancerous growths in the colon or rectum. Regular screenings for colorectal cancer are generally recommended starting at age 45 or 50, depending on individual risk factors, such as family history of colorectal cancer, a personal history of colorectal cancer or precancerous polyps, or inflammatory bowel disease. Breast cancer. Breast cancer screenings play a vital role in early detection and improve survival rates. Mammograms and clinical breast examinations are commonly recommended. Mammograms are X-ray images of the breasts that can detect early signs of breast cancer, even before symptoms appear. CBE involves a physical examination of the breasts by a healthcare professional. The AMA recommends that all women at average risk for breast cancer begin annual mammograms at age 40. Cervical cancer. Screening for cervical cancer primarily involves Pap tests, which examines cells from the cervix for abnormalities. These tests help detect early signs of cervical cancer or precancerous changes, enabling timely intervention. Generally, Pap tests are recommended every 3 years, starting at age 21. Women at high risk may need more frequent screenings or additional tests, such as human papillomavirus testing. These risk factors include, but are not limited to, family history, sexual history, certain genetic mutations, and those with a weakened immune system. Sexually transmitted infections. Screening for STIs is essential to detect infections and initiate appropriate treatment. The recommended screenings vary depending on factors such as sexual activity, age, and risk behaviors. Examples of STI screenings include tests for chlamydia, gonorrhea, HIV, and syphilis. These screenings help identify infections early and prevent complications, as many STIs may not present noticeable symptoms. Mental health. While there is no established schedule for mental health screening, prioritizing mental health is vital for overall well-being. Discussing mental health concerns with healthcare professionals can lead to appropriate interventions and support. It is crucial to address symptoms of mental health conditions, such as depression or anxiety, through open conversations and seeking professional guidance. Your healthcare provider can provide treatment options, therapy referrals, or recommended further assessments. These are just the recommended screening schedules. Your provider may recommend different screening tests or intervals based on your individual risk factors. It's important to note that since 2010, the Affordable Care Act requires most insurance plans to cover preventative services at no cost to the patient. This includes annual physicals, immunizations, and periodic cancer screenings. Check with your insurance to see what is included in your plan. By getting regular preventive health screenings, you can help keep yourself healthy and reduce your risk of developing serious health problems. That's all we have time for today on 6-Minute Health Bites, your go-to spot for health knowledge, one bite at a time. Remember, your health is your wealth, so let's invest wisely. If you're hungry for more, make sure to subscribe, like, and share. Until next time, stay healthy and keep learning.